Good evening, everyone. First, my heartfelt thanks to PS Group of Institutions for having given me this opportunity to talk to all the children over here. So, I think this is a very pertinent question. Should I become a doctor? So, time and again, I meet a lot of young, invigorated minds who, whenever meet me, they ask me the question, Doctor, I would like to become a doctor, and but my parents are asking me to take up their business, which has been part of their family work. And the other extreme is the parents come and ask me, Sir, I want my son or daughter to be a doctor, but he wants to become a engineer or a computer professional or something. So it's always better to hear from the horse mouth, like what it means to be to become a doctor and to be a doctor, and what are the advantages and disadvantages of it. So I would like to start with this story. So I'm not sure how many of you would have watched this interesting movie. This movie goes by the name of Coco, and the main protagonist of the story is this little boy by name Miguel, and he aspires to be a musician. So he aspires to be a singer. But the pitfall here is that the entire family doesn't want him to be a musician. In fact, they don't like music at all. They don't want to hear any songs. But despite all these odds, he fights against everyone, and he wants to be a musician. So we wanted to go to this movie. So this movie was released in 2017, and these my two little ones, they wanted to go to this movie by any means, because I had previously missed on two occasions to take them to two of the previously released cartoon movies. Hence, I promised them that this Saturday I would take you guys to this movie, and I had done my homework, so I booked the tickets. I planned my OP clinic accordingly, so that everything goes according to the plan. But fate had another plan. So this is the same time. So let us call this gentleman by his name Selva Kumar. He is about 30 years, and he had sustained this injury. So he works as a courier delivery professional. So when he was traveling in his two-wheeler to deliver a courier, a lot of our roads have these wires and ropes hanging from the top. So one of these ropes wound around his neck, and he was thrown off his bike. And when he got up, he couldn't get up from the bike. So he noticed that he had a weakness in the hands and legs. So he was sort of paralyzed below the neck. So and when we took a X-ray, he has this a fracture of this neck bone. You can see that the lower part of the neck bone is intact, whereas the upper part has fractured and moved in front. So in that instance, when it moved, it had also injured the spinal cord. The critical spinal cord has also been injured. So at the same time, I was about to leave the hospital, and when I was leaving, somebody catches me near the emergency ward and tells me about the status of Selva Kumar, like he has come with this injury. So at the bottom of my heart, I know that this is a very critical injury. He needs an immediate surgical fixation. So if I fix this fracture, he is going to get back his power in the arms and limbs. So at this instance, many would have a doubt. So they will have a contradictory thoughts going in their mind. So I had already worked for 14 hours in their day. So I came at about 6 in the morning, and I was continuously seeing patients in the clinic. So when I was about to leave by 6 in the evening, so this Selva Kumar comes with a paralysis. And so should I see him like another patient to see and another patient to operate? And if I plan to operate him the day itself, so it's a process. So we need to prepare him for the surgery. And by the time we take him to the theater, it takes another 2-3 hours. And then, so by the time I get back to my home, it will be late in the night. So I have to face my upset kids, so who already have been upset because of the previous two missed occasions where I couldn't take them to the movie. And so it's sort of a somber mood which I'm going to face later in the day. But on the other hand, so Selva Kumar is recently married, so he is a young professional, and he is the sole breadwinner of the family. So he has been paralyzed, and so if I do the surgery immediately, I give him the chance to walk again, do work with his hands again. So it is sort of bringing the fam and the entire family back on course. So what should we do? So this is I did. So I called my home and told them that I couldn't come that day. So again, we postponed that plan to some other day, and that some other week I could take them to the movie again. And surgery was done for Selva Kumar the day night itself. And after the surgery, the next day he slowly started regaining his power. And 3 months down the line, he has reached his normal power, and he was going to get back to his normal work again. So this is one of the multiple instances you will face in your life when you become a doctor. And actually, it's like having a magic wand in your hand. So like one of you become a doctor later in life, like either Krishna or Saranya become a doctor. So it's like Selva Kumar is lying in the bed and he's not able to move his arms anymore. And God has given that magic hand to one of them, either Saranya, if she is standing next to him, and he gives the opportunity to make Selva Kumar walk again. So fortunately, I was in that position, so I was able to help that particular person in that particular moment. So I'm going to highlight a few pros or advantages of why somebody should aspire to become a doctor, and then I will explain few of the flip sides too. So the one important reason why all of you, the bright minds of our present generation, should become a doctor is we need good doctors, isn't it? So whenever you have a problem, or if one of your family members are having a problem, and you want them to take to a doctor, you don't want to take them to any doctor, isn't it? So you want to take your family members to one of the best doctors. So you want intelligent, motivated, passionate, really skilled doctors for the future. Otherwise, our future generation will have poor doctors who are average and business minded and semi-skilled doctors. So people who really want to become doctors, if they become doctors, then it is doing a lot of justice to the profession, and we do a lot of good service to the society. So I think this is the most important reason why one or all of you should aspire to become a good doctor. Second is there's something called job satisfaction. So every job, whether you are a homemaker or you are working, and if you are working as like a housekeeping personnel or a teacher or a professor or a engineer or a doctor, your job involves a certain degree of satisfaction, which varies depending upon the person and depending on the job. But these are the two questions which will determine whether somebody is really satisfied with your job. So at the end of working throughout the day, at the end of the day, if you're feeling really happy, contented, and you're not bored to do one more hour of the same job, then you are having a satisfied job. Again, at the start of the day, next day when you are getting up in the morning and then you are getting ready to go to your work, if you're feeling energetic and enthusiastic to go to your job, then definitely you are involved in the satisfied job. Of course, there are multiple factors like whether the job is flexible for you, does it have any security in your job, whether there are career advancement opportunities, and whether it's giving you enough amount of monetary reinvestments. That all also matter together. Many studies have shown that one of the most satisfying jobs is being a doctor. So you're not only treating some customers or clients, you're actually saving life. You're actually you are having the opportunity to give back a limb to a person, give back eyes to a person, or give back a hearing potential to a person. No other job will give this opportunity to you, and actually you'll be making a real difference in the life of people around you. So there's a clear-cut difference between different jobs. So if you are in a job which involves being an engineer, so your customer or client who is going to meet you is not in a suffering position. But as a doctor, whenever you're treating somebody, you're actually providing a relief from the suffering. The third thing is, if I become a job, the standard question many young aspiring people ask is, there are so many doctors around, will I ever become jobless? Actually, I think India is having a huge population. We are having a 130 billion population. So as long our population continues to increase, the longevity of people. So previously, people's average survival was around 60, 65 years. Now it is increasing more than 70, 75 years. So the more people living in this country, we need more doctors and more good doctors. So there is no dearth of patients, and actually no doctor will ever starve because of lack of funds. So if you ask the question, will I ever become jobless? Never. Once you become a doctor, will always be occupied in your life. Fourth thing is, as a doctor, you will always be reading. So the more you read, you'll become more intelligent, and you'll become only one of the well-read persons of the society. Actually the habit of reading extends to other areas also. So you start reading other non-academic stuff, and the amount of intelligence you get becomes much more, and you actually, it will be a self-perpetuating addictive mindset where you'll be reading and acquiring knowledge over a period of time. And actually, you would have seen people who are having a PhD. So if you're in a non-medical job and you do thesis or a dissertation in a particular specialty, and you complete a PhD, again, what they give is called as a doctor. The reason why it is called a doctorate is because you're getting so much of intelligence and knowledge as equivalent as a doctor. That's why it's called as a doctorate. So you become a part of the elite cream part of our society. Finally, you can become famous. Even though doctor's job is considered now, we are seeing so many doctors around, but still compared to other profession, it is not a very common job. Only a few creamy layer of your society would have the opportunity to become a doctor. Second, the people around you will look up to you for inspirational things, and for any ideas, for everything they will try to come and meet a doctor, because you'll be considered as one of the well-read and very ethical person. So actually we get name and fame, and compared to other professions, everyone is a patient for you. For example, you are working in a corporate big hospital, and if you have become a specialist in some key area, and if the chief minister of that state has a problem, when he comes and meet you, he doesn't meet you as a chief minister, he meets you as a patient. Same holds good for famous sports persons as well as the movie stars. When they come and meet you, they don't behave as a sports person or a famous star, they remain as a patient for you. And finally, in the long run, the interest in the job is a very important thing for you to have a very happy and satisfied life. So more than the money, more than the fame and name which you're going to get, interest in the job is a very keen thing. So as a doctor, what you find is your job is going to be never monotonous. It's always going to be a challenging job. Every patient you see is going to be different. It's not the same patient which you saw half an hour earlier. There'll be a different set of symptoms. Your mind is always working. You try to correlate the clinical symptoms the patient had. You try to apply your mind, get some signs. You do the appropriate investigation. It's like cracking a puzzle. And when you treat the patient and the patient becomes better, you get a satisfaction, like as good you have completed a crossword or a Sudoku. So it's never a repetitive job, and you never feel monotonous being a doctor. And if you become a surgeon, then you feel that your artistic passion and skills are also equally satisfied by being a doctor. So the more artistic you are, your surgeries will become much more better. And communication, if somebody is interested talking to people, you should become a doctor, because the more you communicate, the better you communicate to people, people start liking you. As you yourself would have seen in your personal life, if you meet a doctor who speaks well to you, definitely you'll get attracted towards the doctor. So communication is very important. And a doctor's job is something, not a simply doctor's job. It's a combination of multiple things. You do a job of a tailor, a carpenter, a barber, a chef. You put together multiple things, and then you create something useful for the patient. You work like an artist. We calculate multiple angles, and we correct some complex deformities of the bones. And above all, when you take care of a patient with real attention and love, then you have the mother also in you. And you're almost next to God. So God has created human beings, and whenever there is some problems in the way God has created some people or other, then the next person who is coming to intervene and make it better is the doctor. So if your nose is bent and your doesn't look like, you can do a cosmetic surgery. If God has created a hole in the heart when he created you, then you can fix the hole. We can regenerate organs, and we can actually make babies in the lab by what it is called as an in vitro fertilization. And many times, like I told for the situation earlier, when I was treating Selvakumar, only I alone was knowing that if I do the surgery immediately, Selvakumar is going to become better, and next day is going to become a much more improved person. So actually, I was standing between life and death of a person. Only I was aware, and I was going to make him better. Finally, you are a part of an essential part of the society. So without you, the society is not going to survive properly. So like farmers, like police personnel. So if we don't have a police or a farm, we won't be having normal, sustainable society. Similarly, without doctors, it's become very difficult. So we'll always be in demand. If you're in an apartment, your neighbors, relatives, friends, everybody will seek you for various medical help. And this is the last point I would like to point. A lot of people think that actually parents push children to become doctors because they think that doctors are rich. But I think this should be the last in the priority. The first 8 things which I highlighted are the more important ones. So if you do the first eight things very happily, actually the ninth thing actually will fall into place. It will automatically come and reach you. So usually doctors are reasonably well paid compared to other members of the society. And there are a lot of people who take it as a business enterprise, like an entrepreneur. So they own a hospital, they have a firm, they like a scan center. So in which there are no limits for you to work as an entrepreneur as well. So you have a skill in your hand, and if you have entrepreneurship skills, then you become much more richer in life. And even if you don't have a firm on your own, if you're working in a hospital or somewhere, it is always a secure job. And even if you have to move somewhere, so along with your spouse, if your spouse gets a job elsewhere in the country or outside the country, then wherever humans are there, as a doctor, you're always going to have a job. You're not going to be jobless. And there are always no worries of layoff. Suddenly, if someone asks you to leave from a hospital, don't worry. Immediately, the next day, you can have a clinic on your own. So you're always independent and firm on your legs. So these were the things which I wanted to highlight. But on the flip side, you need to understand there are some difficulties of being a doctor. So the word doctor actually means slogging. So there is no, if there is a synonym for slogging or synonym for continuously working hard, then it is being a doctor. Actually, the process itself, the selection process itself is very difficult. As you all know, the previous entrance exam and currently the NEET exam is a real tough exam. You need to prepare from 10th or the 11th grade itself to prepare for the exam. And so you are working hard to become a doctor, starts in the school, and you crack the exam among lakhs of students who write the exam. You become one of the few thousands who get an opportunity to become a doctor. You think that life has become cool now, but no, once you become a medical student as well, you have to put long hours to study, because as I told, the more intelligent you are, the more you study, you become more intelligent and cleverer. And naturally, we would like to, whenever you have a problem and meet a doctor, you want to meet an intelligent doctor. You don't want to meet a doctor who didn't study properly, isn't it? So the better you study, it's important. And the learning never ends. Actually, whether you become an assistant professor or a professor or a chief at 60 years of age, you don't stop your reading. You keep updating, you work hard. And the process of becoming a specialist also, it's quite a time consuming process. So 6 years you spend in the medical school, and another year you prepare to become join one of the post-graduation specialization courses, like being an orthopedician or a general surgeon. So that takes another 3 years. Then you get training somewhere. And for you to start having a decent earning, at least it takes about 10 years. And whatever the rosy life and a beautiful picture I painted before, it takes at least 40 years in your life to reach that stage of life. So this is a popular meme. I don't know, many of you would have seen that what our friends think and what our parents think when you become a doctor, and what the society thinks is completely different. So actually, when you are a medical student, the last picture is the one which you will be doing most of the time. So you'll be always surrounded by a bunch of books, and you'll be constantly updating your knowledge. And second pitfall is you are always busy and occupied. So one good thing about being a doctor is you're always occupied. You are never jobless. But thing is that never time will never be in your own hands. So you can't say no to emergencies. You can't say to one more patient who comes sick. So you have to attend them, and you can't rush through things. So the patient is having 10 questions. You have to answer the 10 politely, patiently, and many times you may need to miss your sleep. There is no it's not like a fixed 9 to 5 job. So you start at 9 o'clock and then fix at 5 o'clock. So sometimes you may need to start the day earlier, sometimes you may need to finish the day later, and you may need to attend night calls as well. And compared to what the situation was about 10-15 years ago, the society does not have the same respect as before. So many studies have shown that the number of violent incidents happening inside hospitals is quite high. And medical profession is also considered as a service industry now. So you pay money and you have to get a good service back. That's how people view doctors and hospitals. So coming to other option, like many may have aspirations to work abroad. So after MBBS, you also have the opportunity to pursue a specialization or higher education in either England, Australia, or America. And there is one opportunity is that. And a lot of people think doctors as one particular group of specialists, but actually doctors have different subgroups. So either you become a complete medical specialist where you don't operate the patient, you prescribe mainly medications, you do diagnostic tests, and then you just prescribe medications. And the second group are the surgeons who operate on the patients. So apart from prescribing medications, you also have the thrill of doing a surgery. So cutting open the human body and setting something which is abnormal, you're setting it right, is a real pleasure for someone when they become a surgeon. And if you don't want to meet patients, you want to do the good part of being a doctor alone, you can become a non-clinical specialist like a pharmacologist or an anatomist. And some of them, towards the end of their completion of their MBBS course, they think that I am not cut out for this treating patients thing. I would like to do only research. But as you can see, whatever the advantages and disadvantages, or whatever I had discussed, is mainly will hold good for the medical and surgical specialists. As you become more non-clinical and research oriented, you don't enjoy the advantages of being a doctor. At the same time, you don't have the disadvantages of being a doctor as well. So it's always a balance. So
if I could just
sure.
yeah, so one thing now is our chat box is not working for some reason. So in case children you want to ask sir something, you can just raise your hands and Philomena will pass on the questions to us. Children, in case you all have any questions, just raise your hands physically, and Philomena ma'am will just pass the question over to us. Yeah. Sorry, sir, for interrupting. Sorry.
No issues. So I have only three or four more slides to speak about. So either way, it's fine. If you want to intervene and ask some questions, I'll be more than happy to do. But we can take all the questions together at the last. Right. So actually, I feel the advantages are more than the disadvantages. So if you're a really driven person to become a doctor, you'll find that your job satisfaction is at the highest. You'll have a secure job, and every day your job will be interesting. You are not going to type the same Excel sheets every day. You are going to see patients, treat real human beings every day, and you'll be a learned person. And if you do really well, then you will get the name and fame everybody yearns for, and actually you'll be saving people and standing next to God. So whatever God has to do in terms of saving people's life as well as limbs, it's going to happen through doctors, and you become part of the essential part of the society. And last but not the least, you will never starve. You will have a very decent life in terms of richness. Disadvantages, like I already pointed out, you need to really work hard, and actually working hard is something not to be worried or scared about. So actually, my professor used to quote the example of Sachin Tendulkar scoring 200 runs in a test match. So when Sachin opens the innings, he is well padded up. He is geared to face the bowler, and if he misses the ball and the ball hits the stumps, then he has to walk back to the pavilion immediately. So he didn't do much job. He's actually didn't lose much of his energy that day, but he won't be happy at the end of the day, isn't it? But at the same time, if he has to play throughout the day, if he has to score runs and runs after, he has to hit fours and sixes and score 200 runs in a day, it's a lot of hard work. But at the end of the day, actually, he'll be a much more happy and a contented person compared to a person who got out in the first ball of the day. And second thing is, you'll also always be busy and occupied, so time will not be your hand. And depending upon how you take up the job, you may feel stressful. And last thing is, you have a long waiting time compared to your peers. So one of your friends may join a engineering course, and after an MBA, he may land up in a lucrative job much earlier than what you're going to achieve by the 30s. So you may need to wait up to your 35 to 40 years to have a good life. And becoming a doctor is not like any other profession. It's actually a very unique profession. And the most important thing for you to become a good doctor, happy and a successful doctor, is that you should have a passion to become a doctor. You shouldn't be coaxed or induced by somebody else to become a doctor. It's actually people's job. So if you are interested in talking to people, and if you want to make the life of people around you better, then definitely you should become a doctor. So if you have your expectations very low, so like working hard, or not achieving huge monetary achievements so early in life, then actually your life will be very, very happy to rest of your peers. And actually, it's a huge responsibility. So like I told you, you'll be standing between life and death in many situations. So you'll have a huge responsibility on your shoulders. And if you're able to pull it off, then definitely it gives more happiness than anything in life. And coming back to the story, so I actually wish that every one of you can watch this movie. So like I told, Miguel wants to become a musician by any means. So he will run away from his family. He will go to the land of the dead, and then finally will try to become a musician. But at the last, he will recognize that life is more about love and keeping people happy. So whether it is keeping people in the society are happy, or keeping people in your family happier. So it is much more than whatever you are going to amaze, like a lot of money, fortunes, going on holidays, cruises, having flamboyant cars or condos. It occupies only a small part of your life. And by the time you reach your middle life, you understand that caring people and making people around you better and better is that what will give you much more happiness. So just ask this question again to you. So why do you want to become a doctor? Your intention to become a doctor should be the most important thing. It's not by pressure. It should be driven by passion, and it should be the only options. Like you should not have multiple things in your basket. Like I am also having the option of becoming an engineer, so I will try IITG also. Or after MBBS, I will write to civil service exam and become a collector. All those things should not be in your mind. If you want to become a doctor, then you should become a doctor. Sometimes it could be like a love at first sight. So sometimes you get mesmerized, and you get inspired by seeing certain doctors. And if that is the situation, then again, that's the best chance to become a doctor. I wish each and every one of you bright minds to take up medical profession and become better doctors. And a huge future generation is waiting for you to provide skilled, passionate, and compassionate treatment. And my best wishes.